this year of 2020 Final Mile Logistics Working Group. This is, I call this 15th minus one. We had a 14th that got canceled in late March, and unfortunately it was right in the beginning of stay at home. So to mark that date, we'll call this 15th minus one. And I'm super excited because not only have we set a record for registrations and online attendance or attendance for a Final Mile, but I also got a lot of feedback like, hey, I'm so excited. You know, the timing for our in-person events was not always conducive to my schedule, so this is the first time I get to attend. So super excited about that, and super excited that we're making these connections because stay at home, the distancing, it's all about keeping our connections and keeping our work going. So in relation to that, I want to give a big up to the connectors and ask everyone to support and engage their local associations and even become members. And one of those local associations is our own Global Washington that does so much for our community. And I can sincerely say that without Kristin and her small team of champions, this would not be possible today. So thank you very much, Global Washington, to Kristin and her team. So I know these are difficult subjects, but I want to emphasize that I've looked at the audience list, and we have an audience of solution innovators. So with that in mind, I don't want to hear things like these unprecedented times, these uncertain times, these unprecedented uncertain times. But you know, we have solution builders, and let's stick to the cause and take it on as we always do. So and in that light, we always, when we come together, we always do that with a smile. We do that with humor, and a lot of kindness and friendliness. And I know that with Ebola and COVID, these are really heavy topics, and in fact, COVID, the novel coronavirus, is really hard to get your hands around. In fact, if I was to tell you a coronavirus joke right now, I would not know for 2 weeks if you got it. So that's my joke. Why do we do this? I always like to reiterate, we do this for 4 reasons. We do this for networking. We're bringing community together to build community, to create relationships, to create partnerships. We do it to learn. We have great presentations and great discussions. And I can tell you from our the pre-meeting to the meeting, you're going to be wowed by Ann and Brennan today. They're fantastic subject matter experts and great people. We troubleshoot, which we can do in the breakout sessions. If you have some issues that you're working on, just reach out to someone and say, hey, having trouble with this. And lastly, we have fun. And we're going to have fun during this presentation. We're going to have fun in the breakout rooms. And with that, I'm going to turn it over to Kristin Daly from Global Washington.
So great. Thanks, Eric. I can always count on you for a good joke to kick off these events. So that was a good one. Someone said it was a dad joke, but it was good. So yeah, I'm Kristin Daly, the Executive Director of Global Washington, for those of you that don't know me. I love partnering with Eric and the Final Mile group. We share very similar interest in innovation and finding solutions to some of the most pressing problems of around the globe. So it's always fun, and Eric and I really like the networking aspect of these events, and unfortunately that's a lot harder to do online, but we did want to say that we're trying to figure out ways to do that. So one of the things, if you've just joined, please go into the chat of your at the bottom of your screen and type in your name and affiliation, and make sure it's visible to all panelists and attendees, so that you can meet others that are on this webinar right now. And as Eric mentioned, we have an optional half hour at the end that we'll be doing breakout rooms. So they're really fun if you haven't done them before in Zoom, and you'll be in a smaller group to talk about lots of different issues. So welcome to all. Also, I just want to make sure everyone knows we're recording this event. And I also wanted to explain how we're going to do the Q&A at about 1:30. So after Brennan and Ann give some remarks, we'll ask all of you to type in questions at the bottom, not in the chat, but in the Q&A box that's down right next to the chat. And type it in there, and then I will verbally ask those questions to Ann and Brennan, and they'll verbally give answers. So it's just an easier way for us to facilitate. Hopefully we'll get to all the questions. If not, I'll try to consolidate and summarize a few and get those out. So please wait to type in your questions until around 1:30, because Brennan and Ann might answer your question throughout their presentation. So with that, I am just going to introduce the speakers briefly, and we'll get started with the program. First, Brennan Banks is the Director of Disaster Recovery Funds at the Center for Disaster Philanthropy. And he has over 18 years of experience in disaster response and relief. He has extensive work in Africa and has lived in Africa supporting countries there, and also has done humanitarian assistance with 25 countries around the world. Previously, he worked at the Red Cross, again working in East Africa and coordinating disaster response in 14 African countries. He's also headed up operations for the Red Cross response to Hurricane Irma in 2017 and 2018. And most relevant to today's discussion is Brennan was at the Ebola response coordinator for the Red Cross in 2014. And he also led Vulcan's 100 million Ebola response on behalf of Paul Allen. When he was at Vulcan, he actually was living here in the Pacific Northwest, so he has that connection to us here, but now lives in Florida, and lives in Florida. I shouldn't say but, and lives in Florida. So welcome, Brennan. Our second speaker is Ann Peterson. And Ann is the Senior Vice President of Global Programs at Americares. In this position, she oversees the health and emergency response for all the global programs at Americares, and also the global distribution of medicine and supplies for more than 90 countries around the world. Ann has over 20 years of experience and previously held positions at USAID, the Ponce School of Medicine in Puerto Rico, and George Washington University, World Vision, and the CDC. And what I like about Ann and why it's relevant to this group is she really can combine her clinical background with her expertise in systems and logistics, and does that in disaster settings. That's what makes her so effective at her work. Her Northwest connection, she's a graduate of University of Washington in biological sciences, and she's currently in Seattle with family right now. So we're thrilled to have her as part of our community. So with that, I am going to turn it over to Brennan to kick us off, and then we'll go to Ann, and then again, we'll open it up for Q&A. Brennan?
Thank you, and good afternoon, everyone. First, I just want to thank Final Mile and Global Washington for putting this event together. When Eric first mentioned and introduced me to the Final Mile, it reminded me of a disaster history club we used to have in San Francisco many years ago. Disaster managers would get together once a month and talk about a historic disaster and have a few drinks. Today we'll avoid the drinks, but let's reflect and talk a little bit about previous events that are very relevant today. I've been asked to speak a little bit about some of the lessons learned from Ebola that I feel might be very much relevant to the current COVID-19 pandemic. While there are many differences between the two viruses and outbreaks, they do share some common and much needed approaches to contain the spread and prevent further infections in the global south. There's obviously many areas that I could touch on, but with the time constraints, I want to highlight just a few. And I feel some of those more notable areas to highlight today include the role of hygiene promotion, second, information, education, and communications, and then third, innovation. Again, I feel these are just a few of the key areas that I feel made a difference in West Africa. And again, that could be very much relevant for the global south today as they battle the current pandemic. Looking at hygiene promotion first, at the end of the day, if every person on this planet improves some of their basic hygiene functions, we could tackle coronavirus as well as many of the other common diseases around the world. Of course, knowledge of basic hygiene practices and more importantly, the resources like water and soap are needed to achieve this. In West Africa, this required a Marshall Plan that was implemented that witnessed homemade and handmade washing stations placed at the entrance of almost every building, every business, every doorway throughout the 3 targeted countries in West Africa. And when there was no soap or water, hand sanitizer was provided. This encouraged, population to be more diligent about washing their hands, before they entered a building and went about their daily lives. Such a mass deployment of hygiene promotion, both in terms of the soft skills, the promotion, the education and awareness, and as well as what we call hard skills, the materials, the equipment, physical tools to promote hygiene. Again, these are all things that would be very much appropriate and they're currently being rolled out and scaled up in many countries around the world and are necessary to battle the current coronavirus outbreak. Again, similar to hygiene promotion for the general public, we also need to ensure we are protecting healthcare facilities and really investing in infection prevention and control. This obviously plays a very important part in this battle. Controlling the spread and maintaining trust in the healthcare system in West Africa was a very important pillar for the overall Ebola response. During the earlier phases of the Ebola outbreak, many people were afraid to go into a healthcare facility out of fear of contracting the virus itself, and this forced many into hiding while being sick, and it became a huge obstacle to identifying new cases and conducting tracing and controlling the spread. I think we all have seen the current data here in the U.S. confirming, a similar such trend that we've seen here over the last few months. Again, trust and confidence in the healthcare system, it will be tested across the global south. It is currently being tested in many countries across the global south, and we must ensure that their frontline health facilities and workers have the protection they need to protect themselves and others while safeguarding their healthcare facilities. Again, educating the healthcare workers across the global south about IPC could contribute to a more favorable positive outcome and significantly reduce deaths. Also, ensuring that all people have access to information and education during a health emergency is so crucial to containing the spread and preventing new transmissions. And many of us already know this, but we do need to make further investments to scale up and enhance access to information in many of the high-risk countries. And this should be a priority. This should include a two-way platform for the public to not only receive information, but to be able to have their questions answered and have someone addressing their questions in real time. Again, this is not just a mechanism to get information out, but it's also a mechanism to control and address rumors and misinformation, which can be a greater problem in the global south, where people rely more on verbal communication and human interactions to get information and updates. So by having more enhanced interactive communication platforms, that really made a huge difference in West Africa. Some of the success in West Africa included the design and use of mobile platforms and applications to reach the population. And I hope it's not a surprise to many of the people with us today, but some of the countries in the global south have cell phone penetration rates that could rival many of the countries in the north. So using mobile phones and developing applications to more effectively and efficiently push out information and alerts, as well as receive those questions, it was a very effective way of reaching a larger population, especially the youth who are more likely to embrace smartphones, and they can take this information and promote it and spread that information throughout their networks, their family, and their communities. Again, I also hope that there's no surprise to our audience today that innovation in the Global South is real, and it's also very, very exciting. It doesn't get a lot of attention, but both philanthropy and humanitarian organizations should be identifying and supporting innovation across the Global South. During Ebola, we were very fortunate to have the U.S. government and USAID provide a very strong innovation coordination and facilitation role. And this was supported by philanthropy and the private sector, and I think was a huge success that we saw during the Ebola outbreak. Similar to using mobile phones for information sharing, as I mentioned earlier, this is a very powerful tool for the contact tracing and data collection in West Africa. Various mobile apps, some designed in West Africa, were deployed to enhance contact tracing efforts and to address the tough job of field data collection, which is very difficult in some of the countries in the Global South due to logistical challenges, infrastructure challenges. And again, by having these mobile platforms and use of mobile phones was a very effective way of strengthening contact tracing in the field, and really, more importantly, allowing for the real-time collection and consolidation of data wherever that centralized location may be, so that they could follow the outbreak and follow the progress that's being made to contain the spread of the virus. Again, I think we need to further support and harness, this Global South brain power that's out there. I'm sure many of you have seen reports, coming out of, some of our African countries, Senegal and Kenya, where there's been a lot of progress already in diagnostics and other areas. And again, there's a lot of opportunities for us to invest in innovation in the Global South so that they can be in the forefront to address the current outbreak and contain it. Also want to note, medical science investments, are also very vital, but often these require a large investment, with a commitment to success, with a higher tolerance for failures. But there are platforms, there are key stakeholders, and again, I'm speaking to my former colleagues in Washington and in the global health community, so I'm preaching to the choir here. But obviously, there are a lot of opportunities for us to explore those partnerships where we can make those investments in the medical science area as well. Lastly, as we continue to examine some of the lessons learned from Ebola and how best to support the Global South with COVID-19, we cannot overlook the fact that there are many marginalized and or vulnerable groups in these countries. These could include indigenous groups, tribal or ethnic minorities. It could include the homeless. It could be refugees and IDPs, just to name a few. And it's really important that these groups be targeted as well and involved in the overall response. Again, because we're dealing with an outbreak as opposed to a natural disaster, targeting these groups is more important than ever, so that we deploy and maintain a most comprehensive and most inclusive response and outbreak containment as possible. Unfortunately, again, the higher number of Global South countries lack some of the civil society, government, and social services support that you would find in other countries. So again, filling this gap is critical, and shoring it up during such a health emergency is really important to ensure that we have larger coverage of contact tracing and other forms of interventions needed for such a health crisis. So again, in conclusion, I think there are many, many lessons learned that came out of West Africa. I think, we can do a deep dive in many of these areas, but for me, these are sort of three areas that I remember as being areas that were most impactful in West Africa. And these are areas that had very unique challenges, given the context, given the environment and the countries that we were operating in. But again, innovation and effective partnerships were used to address some of these areas and to grab the local brain power and encourage local innovation to address some of these areas. And it was just really an awesome experience to be a part of. Before I leave, I also would just want to highlight, I think having a strong, effective leadership from the government is also very, very critical. I don't know what role we play in that, except maybe, advocating for a larger role of government when and where it's needed. But again, linking this back to West Africa, I think, Liberia, Sierra Leone, and Guinea, having strong, consolidated central power in the president of those countries, I think also made a huge difference for the battle for those three countries. So I think it's really important that the global south and the countries that are trying to contain the outbreak, that they have very determined, strong, effective leadership. And that, again, I think was a key lesson learned for some of the success that we eventually realized in West Africa.
That's great. Thank you so much, Brennan. That was really informative. It's so great to hear your perspective from your perspective of doing the work with the Ebola response and what we can bring forward. So fantastic comments. I'm going to turn it to Anne now. So Anne will speak for about 10 minutes and then we'll go to the Q&A. Anne?
All right. Thank you, Kristin. And I want to thank both Global Washington and Last Mile for allowing us to talk about this. What we always want to learn, and we also always want to apply what we learn, but we're so busy responding to so many disasters. Sometimes that doesn't happen. And so just getting ready for this, it was a really nice opportunity to sit back, reflect on my time in West Africa. And I was in both Liberia and Sierra Leone, thanks to some of the colleagues that are on the call with World Vision, looking at the civil society and the government interaction in the Ebola response. And so that's a really nice sort of grounding to the kinds of things that we're looking at now. I've structured my remarks, because I'm a problem solver, with what did we do well this time, probably because we learned some lessons from Ebola. What are we maybe doing a little better, but not as well as we should? What are we still not doing as well as we should, that we could have learned from Ebola, that we know from those examples? And then lastly, just what are we doing? So I've just got a couple of points for each one of this. I think some of the things that we did learn during the West Africa Ebola response that we are doing now is, first of all, valuing the frontline health workers. You see it on television, you see it in all of the messaging. I think it's really, really important. They are the ones who are putting themselves at risk and standing between many of the people and the patients and caring for them. And so valuing the healthcare workers, there are some exceptions where that's not being done well right now, but it's really stepped up. And I've never seen such a strong messaging around the value of healthcare workers or even of health systems. I think we've done a good job in paying attention to the surge of clinical services needs that happened in Ebola. And it was sort of like we were surprised, and it took us months to get Ebola treatment units up, and they were done about the time that everything was getting better. I think we stepped up much faster this time. And I particularly liked Chris Murray and IHME's data forecasting that looked at different countries, different states, and says, here's where the outbreak is going. Here's the beds, the ICU beds, the ventilators that are going to be needed. And I used it at the beginning every day to say, within our US work, where should we be focusing our efforts to get ahead of the next hotspot? So that paying attention to surge and using data to do it, I think came out of our COVID response, or our Ebola response as well. Similarly, when you have surge, you have needs for stuff, in this case, PPE. That's obviously a shared need with both Ebola and COVID. And there was a very strong, very fast emphasis. It was hard to get, but people worked hard to overcome those obstacles and get it out very quickly. So that was a lesson learned. Again, it was much slower in Ebola. There were early messages on infection prevention control that were disseminated widely. We heard it quickly and fast and consistently. I think that's something we learned from there. And the one that was one of my favorite, maybe wasn't from Ebola, but we have a lot to learn, but right now we know this much, and sharing that information and the not pretending we knew it all or that everything was set in stone, but saying we're learning. We're going to learn fast. We're going to tell you everything as we learn. And one of the other, my last on sort of what we've done better, the focus on the mental health and psychosocial impacts of the outbreak. We touched on that very late, but it was profound in Ebola, with fear, as in COVID, being a driving factor. And I think it's come to the forefront very quickly here, perhaps because it hit the US so hard, and because it wasn't just the fear of COVID, it was the fear of all of the societal impacts. And so people were verbalizing their discomfort from being locked down, at risk, et cetera. So I think we're doing a lot of things better. That's really good news, because we'd hate to be doing things the way we had done before. Some things that I think are mixed. My first week in Liberia, I was going, where's the testing? Where's the testing and triage? And I said over and over in front of Congress and elsewhere, we needed a rapid diagnostic test to go in and triage and separate. We're doing better. There's been a heavy emphasis on testing, but less than we should have. And frankly, we still don't have a rapid diagnostic test that we can rely on. So there's a little bit of a missing piece. We move faster, but not quite fast enough. My role in West Africa was that civil society government interface. And it was really fascinating to walk through the slums of Monrovia and Freetown and talk to women and men and say, well, if your child got sick, would you bring them to an Ebola treatment unit? You know, that's the message. Ebola kills, go to an ETU. And they said, why in the world would I take my child with fever or diarrhea in? That's where you get Ebola, and they're more likely to have malaria or diarrhea or regular pneumonia. Nobody had asked them why they weren't going in and following the different messages. And so I think we've done a little better at listening to the communities, but even some of the messages now, stay at home, isolate yourself. Well, that works for lots of us. I can work from, home and distance. But if you're a day laborer who relies on going out and doing work every day to feed your family, you can't stay at home. And that's true in the US. It's also very true in the informal sector that dominates many of the countries that are about to be hit by the next wave. So we are doing better. We could still do better at listening to the community. If the purpose is social distancing and reducing communicable disease, is staying at home the only way to deal with it? Or is there something that is going to be functional for those who can't do it? And we need to think and problem solve perhaps a little differently, especially internationally. I think our information sharing, as Brennan pointed out, is just way better. The number of peer-reviewed journal articles, every day you could spend all day reading about COVID and the most recent research. I think that has helped to share transparently. That builds trust in a better ways than perhaps happened previously. I think there still are rumors that go flying around. I feel like the information sharing has tamped down those rumors much more quickly. So progress, but not perfect. I don't know if we ever get to perfect on that one. And then I think in our mental health area, we're paying attention to it, but many things that we do in global health, there's sort of the divide that I call the rhetoric to action divide. We're talking about mental health, psychosocial, but we haven't got as many interventions and actions on it as I think are probably needed. And we need to go to the rhetoric, move from rhetoric to action in the mental health area. What aren't we doing well? Well, we don't yet really have a trusted voice. This has become very politicized. Same thing happened with Ebola. WHO isn't really trusted. CDC has had some difficulties. We don't have a trusted voice, whether it's at a leadership political standpoint or a health person or local community leaders. I think one of the most effective things I saw in West Africa was World Vision's engagement of both Muslim and Christian faith leaders who were trusted by their communities. And when they were well informed, they were able to disseminate messages more effectively and have them acted on. I think we could do a little more work on how do we find a trusted voice in these, difficult, I didn't say uncertain, Eric, I stopped myself, just so you know. And then I'll tell you my big passion, the just like overwhelming thing for me right now is the issue of excess mortality, morbidity and mortality. And we're starting to see some articles about it, but it isn't those illnesses or deaths that are undiagnosed COVID. There are probably some of those. It is all of the people who do not have access to their regular care, and there are preventable illnesses and diseases happening. I saw this after the Hurricane Maria in Puerto Rico, when a man came into my hotel and said, I'm a diabetic, here's my insulin, but I don't feel well and I don't know where to go. And it hadn't been refrigerated, and his blood glucose was over 450. We tested in the lobby of the hotel. Those people die in these circumstances. In West Africa, they stopped the malaria prevention programs, they stopped vaccination, they stopped the child nutrition programs. Women couldn't get in for safe delivery. And you don't just lose people at that moment. When you stop all of the access to regular primary care services and preventive services, the tail on that excess mortality that isn't the infection itself, it isn't Ebola, it isn't COVID, it's chronic diseases, diabetes, hypertension, that lasts for a long time. I interviewed a nurse in Liberia who was an Ebola survivor, and she tells the story of being brought to the Ebola treatment unit. On the day she was brought into the Ebola treatment unit, her father had a hypertensive crisis and went into a different hospital. On the day she began to get better, peaked in her Ebola and began to improve, her father died in that other hospital because all of the resources had been transferred to addressing Ebola. We saw the harm it caused before. We are not yet paying enough attention to this one. There are places that have stopped their childhood vaccination, and we shouldn't allow this to happen this time. So for me, the big message is it's all about access. It's access for COVID patients to get care. It's access for everybody else to have access to their normal services. And for example, in the US, it's access for those who have lost their health insurance, their access to a health provider to regain that access. And if we do that, we will prevent more deaths at a societal level than a singular view just on COVID. So I'll stop there and turn it back over to Kristin and Eric.
That was great, Anne. It was a really good on-the-ground kind of perspective, again, of what we've learned and what we haven't learned. So thank you. It was really good. So I'm going to turn to questions from all of you now. So please, again, go into the Q&A tab that's at the bottom of your screen and type in the questions there. I'm going to take the liberty, though, and ask one of the first questions. Both of you talked about the importance of leadership, both at the government level and at the community health worker level or NGOs that are trusted in the communities. I'm wondering if each of you could give an example of good leadership that you've seen. You don't have to name names, you can give examples, but if there is a country in particular where you feel like the national government is strong in their leadership and their approach to COVID-19, please let me know. And then maybe that's more for Brennan. And then Anne, if you could think of more at the community level, if there's a nonprofit, or if you see where there's a lot of support for community leaders. Brennan, you want to start?
Yeah, thanks for that. And, I think this continues sort of my last thought, on that leadership from the government side. And I agree with Ann, that leadership at the community level is equally as important, because you need to make sure that you're engaging the community level networks and supporting the leadership in those communities, so that they can speak to their residents and organize them, and be, more importantly, a focal point for any services or interventions that might be needed in that community. But coming back to the government level, again, it's sort of one of those things where I think most of us would prefer not to live in a country with a strong presidency or a national government. But in this case, having presidents in Liberia and Sierra Leone, to name the two that's sort of top of my list, having them being out there and being able to make decisions on just about anything, big and small. In this case, you want that type of strong leadership, because you need someone to be able to come in and make quick decisions and be able to mobilize government resources, government ministries, and so forth, to be implementing the decisions on behalf of the government, and more importantly, holding them accountable, ensuring that they're actually implementing the activities and services that they're meant to be doing. So again, in this case, having that strong national authoritarian leadership can be a great tool, in a situation like this, and ensure that government is actually doing its job and playing its part in the overall response.
Fascinating question. I was pondering as Brennan talked, where could I think of a good example? I can say where I would like to see this kind of leadership coming from. I would love to have seen WHO in a place where it was trusted and had a voice, because that would have been a centralized, unifying factor. And Margaret Chan did some of that, perhaps a little more successfully in previous, outbreaks. In the US, I was part of the anthrax response way back around 9/11. And the Surgeon General in the US was the spokesperson for the response. And that is, this is a health problem, but it's much more than a health problem. But people's first fears were in the health arena. So I would have desired a really strong health voice at that level. That isn't always possible. Brennan talked about presidents in countries. Ministers of health in some places have served that role. So I think that it's a variety, and it depends on the country itself and where there is trust within the countries. In West Africa, with histories of civil war, the government was not the trusted entity. Even with a strong, government system, they were not completely trusted. And so really the civil society sector was likely the place to go, but it took a while before the international response realized that there was both a need and a voice there that could get the message out. And, I was at that point a consultant for World Vision. I asked specifically, I said, please, could you send me to West Africa? Because I'm worried about the community voice in this outbreak. And they allowed me to go. And what they did in bringing the faith leaders, they had imams going to churches and pastors going to mosques, and they were trading back and forth, and they were getting examples of best practices from Uganda and bringing it to West Africa so that it was all within a trusted area. I think that those are the kinds of things that we can and should do. And we're on the front end of that still in many of these countries. And I'm still hearing the talk about working with only the government sector. And I think we really, and especially the NGOs, have the opportunity to go and work with civil society leaders. There are the faith leaders, there are municipal leaders, there are non-denominational or cross-faith organizations within countries and regions. We should be connecting with and trying to mobilize them, because they will be trusted by the people in their communities.
That's a really good point. I'm hearing that from a lot of the other NGOs as part of the Global Washington Network, and they really are, they're the staff that have been in the country before the pandemic, and people turn to them as trusted people in the community. So that's a great comment. So we have a lot of questions coming in. There's a couple of questions that I'm gonna put together. One of them is to compare what we know about the United States and what we're doing about COVID in the US, and how does that apply to the Global South? So in particular, if you both could talk about the restrictions of movements that we have, the stay-at-home restrictions that we have in the US, and the use of masks. How is that being applied? What does that look like in the Global South? Is that effective? And how do you compare the two? Brennan, do you want to take those?
Yeah, I'll maybe touch a little bit on the logistics and the non-medical side of the question, and then maybe Anne, you can touch on the mask and sort of how the movement of people affects the containment of an outbreak. But we talk about the movement of people. I want to include goods and resources, because people move goods and resources. So when you put limitations on people, you're not just limiting the spread or trying to reduce the spread of the virus from one person to the next, but you're also making it very difficult for vital resources to be moved by those people, as one example. So you have sort of secondary effects on your logistics, your supply chain, if you're keeping people indoors. And think about, we've all seen that here in the US for the last 2-3+ months. It seems like it was just a few weeks ago. It was a few months ago that we started this interesting journey. But as soon as we started to limit the movement of people, there were just a whole host of secondary impacts and consequences when you have a decision like that. And a lot of that, again, is affecting the economies. It's affecting the legitimate movement of people that need to move for livelihoods. They need to move to support their families. They need to move for whatever reason. So when you contain or limit the movement of people, you're really affecting so many areas that are needed in order to fight and have the overall battle. So, but it's always a difficult decision because sometimes it's needed, but you definitely have to have a very strong, clear plan in place on what those limitations are going to be, who is exempted from that, and what that looks like. And I think that's most important, is that you have a very clear plan in place that is articulated to the public, and more importantly, it's done in a consistent manner. I think the biggest challenge for the U.S., if I might take another moment, Anne, is because we're 50 states and we've had 50 different approaches. And then if you look into each individual state, I use Southern Florida as an example. Each county has its own policy on staying at home or what businesses can open. And furthermore, each city, and for those that know Southern Florida, it's just one continuous street of multiple cities after each other, like similar to Southern California. So you're literally at a street light, you go through the street light and you're in another town, you don't know it. But as soon as you enter that town, here's the rules for this side of the street, here's the rules for that side of the street in terms of how people can move, what businesses can open. So not having a consistent national strategy or plan, I think, has also been a unique challenge for the United States, and it's confused people, and that has not been very helpful for any decisions related to limiting the movement of people.
Oh, thanks, Brennan. You said a lot of what I wanted to say. I would start with sort of from my public health, global health background. Quarantine is not the most brilliant way to stop epidemics. It's sort of our last ditch when you need to lock people down, but it's really hard to have a society that is functional in quarantine. We've also not known what kinds of interventions are going to be most effective. Is staying home actually more effective, or should we all have gone out and hiked the mountains far away from one another and done social distancing that way rather than sitting at home and everyone feeling claustrophobic? There's also phases in an outbreak. Very early on, what you want to do is stop it from spreading and getting out into the general community. But it's pretty far out there now. How much difference does it make now to keep people locked at home compared to, you know, at the beginning of the outbreak, or maybe when it surges again next fall. So I think part of it is we are learning, and it is, the circumstance is changing. It's hitting different states at different times. It's going to hit different countries in the world at different times. So the answers are perhaps not so easy in pat, though we are learning that masks help. We don't quite know how much they help. Is it 30% or 50% reduction, or is it 5% reduction? I would also say we've done a brilliant job of counting and watching every day the little ticker on how many people have gotten sick and the number of deaths due to COVID. We haven't measured the number of people, well, we have measured people who've lost jobs, but we haven't looked at changes in income, other people who've died of other things because of COVID. We've measured one part of the impact of COVID and not measured the other impacts of COVID. And so we're getting a lopsided view of what the outbreak, the pandemic, is doing to us. And if we looked at it, I think, much more even-handedly, and we're measuring all of the different aspects, we might say, well, this helps some, but the cost and what it's causing over here is far larger. Maybe we need the balance to shift a little bit. And that has probably some profound impacts on different countries. So El Salvador, where we run a polyclinic, has locked down very early, before their very first case, and pretty draconian. They had police out there and with rifles telling people to go home. They are now realizing after a couple months, their country cannot stay locked down like this any longer. And they're having to open up a little bit earlier. And so I think we don't know quite what the balance is, and it's probably more difficult than we think to make those pronouncements. And that's going to give some of the variability that makes it so much more uncertain, and leaves people not knowing, should I be wearing a mask? Should I not be wearing a mask? We'll learn more a year from now when we talk about the lessons learned from COVID for whatever the next problem is. We're going to be able to say so much more about those issues.
That's great. So there's quite a few more questions. Let me, I'm going to combine a couple, and then Eric has a question as well. There's a lot of questions around communication in terms of how do you communicate effectively, especially in regions where there might already be conflicts, either violent conflicts or just unrest or clashes. So again, how do you get the message through effectively, and what kind of technologies and mechanisms are you using in addition to what you talked about in terms of the local leaders giving the messages? Brennan, you want to start?
Sure. Thanks for the question. I think it's an important question. It sort of continues, one of the thoughts that I had earlier. First, obviously going into a community, engaging the community, speaking to community leaders is the most effective way to share information and ensure that information is embedded in that community. However, that's not feasible, in a health emergency, and it's something you can't do every day or every hour or in a very timely manner. So it's not very efficient in such an environment. So you have to look at what are your other avenues and platforms. And quite often, again, social media and smartphones and mobile phones, SMSs are very cheap and effective way to get out communication to a large number of people, and in a quick amount of time. So, that's one platform. Again, we still have a lot of countries in the global South where radio is the primary source of information for families and communities, especially in rural areas where, the TVs might not be in a high number, but you can always guarantee, there's a radio nearby somewhere. And for a lot of people, that's their primary source of information, where newspapers are not reaching them. Again, television media is not reaching them. So, for me, those are two very, two routine avenues and sort of platforms for us to get information out in this type of environment. Again, it just needs to be in a quick, timely manner, and see how you can reach as many people as possible.
Yeah, I would play off of something Brennan talked about earlier with the phones. WhatsApp has been phenomenal at being able to be a platform to sending out messages and getting it to patients. We're doing basically teleconsults in the slums of Mumbai using WhatsApp. So I think there are some opportunities there, but I completely neglected to do probably our main focus on how to get information and communication out. And that is, we're a health facility focused organization. The people in those health facilities, like faith leaders, are also trusted leaders. And so one of the things that we can, and our organization is doing, is trying to build the capacity of those healthcare workers and those healthcare facilities to be ready for and respond to COVID. So we're pushing out training in preparedness, in IPC, in WASH, and in mental health resiliency for healthcare workers, for themselves, as also for how they will deal with their patients when they come in. So that focus on getting the right information in the midst of all of the infomedia and information overload on COVID, to collate, tailor, and get to those healthcare workers who are seeing the people in the community the best information and the right places to go to, so that they will be well informed and can be our dissemination communication arm. Increases our ability to reach people 100-fold. We can and do make that available to health facilities in many countries across the world, and would be happy to do so through here as well.
That's great. So I want to have Eric ask a question that he has, but also I have a question for Eric. There are some questions coming in about the responsibility of the private sector who are working in the global south, whether it be a multinational or even a local company. How can they protect their workers directly from COVID, or what is their responsibility to their communities? So I don't know if you have a perspective on that in terms of a private sector working globally. And then also, before we run out of time, there are questions about if any NGO has shareable information that they can use. And I encourage everyone who's on this call, if you work for an NGO, put it in the chat. If you have a place on your website that has a downloadable pamphlet or information, especially ones that you can transfer into WhatsApp, please put that in the chat and share it with everyone on this. But Eric, do you want to talk about the role of the private sector in the Global South? And you can ask your question to Anne and Brennan as well. And turn your mute off first, Eric. There you go. There you go.
Just briefly from our perspective, the private organizations operating in the global south are right now still trying to protect their own programs and people. And when we talk about Sierra Leone and Liberia, I can tell you there's zero commercial capability to get even PPE into those countries right now, to either ROB or FNA airport. It's all by charter. There's going to be one organized this coming weekend out of Belgium, but those are serious lockdown situations, and you have people screaming out for PPE, and it's a really difficult situation right now. We hope that's going to get a lot better. That we expect it to get better towards June 20th, when Brussels Air might start operating again. But we're really hampered by these lockdown situations being so stringent. We're as opposed to Uganda, we can once a week or 3 times a week we can get material in there, and that's fine. But when you cut it off completely, there's some serious stockouts and situations, particularly with Sierra Leone and Liberia right now. So it's difficult to operate in those scenarios. South Africa just opened up yesterday, so hopefully things will start moving in June. But that's what we're most concerned with. On my question, Given what you both said, what would lessons learned for the Global South, fear of bringing your loved one into care, would you encourage use of ICU units, because we count those, or some kind of emergency operations center that's outside of a hospital unit? That's it.
Yeah, I'll take that one because I'm here in Seattle and I moved here right before COVID hit this, just as it was hitting this area, to take care of my 90-plus-year-old dad. And he has he'd just been in hospital, multiple health conditions. And so every day I have to try and balance, do I do his care here at home with me as his medical doctor? And I'm more public health, global health now than clinician, or do I risk taking him into a healthcare setting? Do I know whether my siblings who are in other places have been exposed to COVID? How do I surround him with, a greater sense of, quarantine, safety, et cetera? So it's very real on a personal basis for me. And I realize it's replicated across the US with the nursing home deaths and across the world. How do we protect our most vulnerable people? When do we make decisions about, is there urgent medical care for something else? Does that override the concerns for exposure to COVID? And it's just really hard. And I will tell you that in the last 3 months, there have been many days where I'm going, his care is being compromised because I can't bring him in. An occasional telephone call isn't sufficient for somebody who needs to be seen and evaluated. And I think, if this lasts for a very long time and stays where we are, we have to get to the place. I'll go back to my comments on rapid testing and triage. We have to have a way to better separate those who need ongoing health services and aren't COVID from those who have COVID and could potentially spread it to them. So I think it's going to be very challenging, and testing can help us. I'm waiting for antibody tests so I can know who's already had it, so I can surround my dad with all of the people who, can't get it again, at least not right away.
Brennan, do you have anything to add for that? Okay.
Can I go back to the PPE just really quickly?
Yes, please.
We're about medicines and medical supplies, and we have been, for the first time, procuring millions of dollars worth of PPE to distribute. I completely agree with Eric's comment that the lockdown has hindered that. What we've been trying to do is, in advance of the outbreak hitting a country, going and negotiating waivers so that they will allow us to continue to move and get things in. We emptied our warehouse in Liberia pretty much completely before the lockdown so we could get as much of the PPE and medicines and medical supplies out. And I will say it's not just the PPE, because if you recognize that people still have all the other illnesses, they need their antibiotics and their insulin and their hypertensive drugs as well. And if those can't get in and can't get distributed, again, you have the excess mortality, and that is from the logistics. So we are pursuing very hard, if you have a good relationship as an NGO with the government, you have a better chance of pre-negotiating those waivers. They're harder to negotiate after the fact.
That's great. So we are at our time for this program piece of the program. I want to thank Anne and Brennan and Eric, of course, as the co-host. That was fantastic information. It was fascinating, and I learned a lot. So hopefully we can continue to learn from the Ebola crisis. And as Anne said, hopefully in 10 years we can come back and talk about hopefully a better response to COVID in the global South. So what we're going to do now is switch to the breakout section of our program. And what we're going to do is we're going to ask all of you to copy and paste a new link into a Zoom meeting. And you'll also get an email, and then we'll put you in breakout rooms. Unfortunately, the webinar function of Zoom cannot do breakout rooms. So we're gonna flip this over to a meeting format. So you'll need to copy and paste my colleague Pratima. It's up on your chat right now. You can click on that, it looks like. If it asks for a password, the password's global. So go into this Zoom meeting, and you should be able just to click on it, and then we'll divide you up into breakout rooms for the networking and breakout room section of this. Thank you all again for joining. Stay in touch with Global Washington and the Final Mile group for more events in the future. And please click on the link and join us for the breakout sessions as well. Thank you.
Thank you, Kristin.
Thank you.